like I mentioned earlier, Dr. David Ames, who is a psychiatrist here in Greenville, and he's been practicing psychiatry for Dr. Ames. You want to tell us how long you've been practicing?
40 years.
40.
Wow,
You said that
that's
proudly.
great.
That's a good thing.
Yeah. It's a
That's
blessing.
wonderful.
Yes, it is. Absolutely. It was a blessing that you're in Greenville because, like I said, when I called Dr. Morrow, he immediately said, you know what, you need to call Dr. Ames. And I had called on Dr. Ames as a drug rep, and I know how what a great reputation and a great how well respected you are in the community for your work in psychiatry. And we were talking before the show, and you were telling me you spend about half your time with treating drug abuse, right?
Drug and alcohol, substance abuse in general.
Mm-hmm.
That's right.
And then the other half at the for mental health
Yeah.
at Port Human Services.
Yeah.
So you're there full time.
Well, I'm there full time, but I only work 3 days a week.
Oh, nice.
So
That's a good schedule.
I don't know quite how you classify that. It's
Right.
a wonderful schedule.
Yes.
I strongly recommend it.
I bet.
Yeah, if we can figure that one out.
I'm sitting here like you don't even know how much my mind is racing around that 3-day-a-week thing, and I can't seem to figure out how to do it. So.
Hopefully we'll all get there.
Yes, that would be awesome. So, well, I know you do great work in the community in the mental health department. So, but we were talking here, like I said earlier, the Philip Seymour Hoffman thing, and then it seemed like every time I turned on a show that was a news magazine show or 60 Minutes, any of those kind of shows, or in the paper or wherever on the internet, the focus on the celebrities that were overdosing on with drugs, and in particular heroin. And I know we're going to talk about a lot of things today about substance abuse, but heroin seems to be an increasing problem and an increased availability, I guess. And I'm sure treating it has got to be a challenge of substance abuse. But here are the ones. Philip Seymour Hoffman's the most recent. River Phoenix. That was years ago, wasn't it, Joey? River Phoenix.
Oh, yeah.
I mean,
Yeah.
like, he was young, right?
Oh, yeah, he was really young.
John Belushi.
Corey, whatever his name was, from Glee.
Monteith, wasn't it?
Mm-hmm.
Yep, that was very recent. Chris Farley, big comedian off of Saturday Night Live. And then, of course, Janis Joplin, I think, in the 1970s, maybe?
Mm-hmm.
Was she that? Was that the 70s when she? I don't know.
Or late 60s,
Anyway,
I
it
don't
doesn't
know.
matter. But the point
Yeah.
is that a lot of, but the celebrities that get the hype about this, and let's just face it, I mean, it's right here in our community, and whether you're a celebrity or not, it's a problem.
True enough.
So, and just a few more stats to throw at you. Individuals of all ages use heroin. Data reported in the National Household Survey on Drug Abuse indicates that an estimated over 3 million residents aged 12 and older have used heroin at least once in their lifetime. The survey also revealed that many teenagers and young adults have used heroin at least once. 76,000 individuals ages 12 to 17 and 474,000 ages between 18 and 25. Now, there's a lot of disturbing facts about that, but the age of 12, do you see that commonly here?
Well, yes and no. I just want to make one point early, and it's opioid pills, pain relievers that are the most popular opioid. Heroin is an opioid, but it's much less prevalent than things like Percocet, OxyContin, Vicodin, and all those other drugs. And yes, at age 13, it is the number one drug of abuse of young girls. And I assume it has something to do with beginning of the menstrual period, and girls get given these opioids.
Pain relief.
Yeah, pain relievers, begin using. Well, for whatever reason it is, at that young age, it is the number one drug of abuse among girls. Subsequently, as time passes, it becomes marijuana and alcohol. Mm-hmm. But at age 13, that is a drug of abuse.
Is there some personality trait or characteristic that you've either researched or have seen any particular correlation with someone that tends to be more abusive to drugs?
Two things about that, Jennifer. First of all, it was always taught that the person that's more of an extrovert, outgoing, adventuresome, is more likely to get into trouble, more likely to use. And that makes sense because if people are willing to try anything, then they get exposed to it. But being exposed to it is a necessary but not sufficient variable. You have to be predisposed. So I put it this way to my patients. 10 people get together and drink or smoke or use marijuana, whatever. 9 of them put it down, suffer no ill effect. About 1 out of 10 does not put it down. And there's a genetic rule there. The fact that they use is basically their friends. It's a social thing. Friends introduce you to drugs or alcohol. And if you're curious and you hang out with the right group, you'll use to have fun. But again, 9 out of 10 people that can use will quit. 1 out of 10 won't. And that one person, to the best of my understanding, is genetically predisposed. So my guesstimate is about 10% of the community carry the genes that make them highly susceptible to addiction.
And that could come from any socioeconomic
Yes.
background. It doesn't, it's where it doesn't discriminate.
No, there's no discrimination, rich, poor, black, white, upper class, low class. It doesn't matter at all. Addiction is an equal opportunity illness, and it affects everyone.
And just in your practice, and how you said half and half, so your time you're spending 3 days a week in practice with this, is it? I don't know what half is. I mean, what is the number there that you see, like on a weekly basis, on dealing with mostly teenage? Is it mostly teenage?
No, my practice is mainly adults, but I mentioned to you I work at Port Mental Health Center, which is one of the private groups that sprung up in Greenville after the mental health center was closed, and they're heavily involved in treating substance abusers. We have about 480 individuals in Pitt County who are in treatment for opioid addiction, which is fascinating. We began the opioid treatment program at the Pitt Mental Health Center in 1990. Prior to that, there was no treatment available east of I-95. So we began in 1990, and people said, there are not really that many opioid addicts. Why are you doing this? Well, lo and behold, once we had something available, people began to come out of the woodworks, mainly heroin users. And this is a fascinating thing, that when we began, the typical patient was your stereotype, what people refer to as a junkie. It's an older individual who had been using for 20 years. Their health had deteriorated. They frequently had no family support. Oftentimes were physically sick, AIDS, things like that. 10 or 15 years later, I looked at our population, at our patients, and I was surprised what had happened. That group were now the minority. And what we had, the majority of people coming in for treatment were now young adults. We're talking about 18, 19, 20, 25, that age group. Those were the majority. They were still had a home. Most of them still had families. They still had work. Many of them were students at the university or Pitt Community College. And they were coming in not for heroin, but for pills, pain pills. And over the years, pain pills have displaced heroin as the main opioid of abuse. It's all about pain pills.
Do you think that is based on availability?
Yes. And there's a direct correlation between the access to pain pills, the availability in community, and use.
And these are like pharmacy jumpers.
Well, Yes and no. There are physician jumpers too.
Well, that's true. They have
And,
to have a physician to write the prescription. You're right. Yes.
Right. And what has happened was that
Or they just are buying them black market or something like that.
Yeah.
too?
well, what happens is that I go to the doctor and complain of pain, and if I get to the right physician who doesn't really care too much about investigating what's wrong, he'll write me a prescription, 3 tablets a day for a month, refill 5 times. Well, I use 1 tablet a day, and I sell 2. And I have patients that tell me that that's the way they pay their utility bill. They sell 50% of their prescription and use the other 50%. Well, the 50% they sell is soon dispersed among the population. Youngsters in high school, other addicts, and so on and so forth. They begin using them and they get hooked. They begin using them thinking it's fun. They want to feel good. And then they end up, if they're genetically predisposed, they end up becoming addicted. And once they're addicted, they really have a monkey in their back. It's very difficult to deal with addiction. And that's a big part of what we do at Port. Unfortunately, there are now some very effective medications. And so, Jennifer, you were a drug rep. You appreciate that. But in the old days, it was difficult to treat an opioid addict. The advice to parents used to be, forget about them.
Well, let me ask you this. Couple of questions, actually. Is it a myth, or is it just kind of an excuse for some? Well, it just started out with alcohol, and then it evolved into marijuana, and then it evolved in opiates. It sounds like to me you're saying to the community that it's starting with the pills now. Is that true, or are you seeing a trend there that is it to a point where somebody can tolerate some alcohol, and then they need something in that personality trait that you seem to have identified that some people have that extrovert, the traits that somebody has? Do they need more? Do they need it to be stronger? Do they need it to have a different feeling?
I don't know. I will say this, that the opioids, the patients report that when you use an opioid, you have a sense of well-being, of peacefulness, and it's very much appreciated by people who suffer from anxiety.
Okay.
People who suffer from anxiety are looking for something that will make them
Calm their nerves. Yeah.
Exactly. Calm their nerves, and these pills do that. And so they're particularly prized by people with anxiety disorders. But again, I think to a large extent we're looking at a genetic predisposition to all kinds of addictive substances.
And and I don't know if you know, I don't know much about all these. I just can't even imagine. But now I hear that not kids or people in different forms in which to take it, whether it's inhaling it or crushing it or what. Is there a difference in the way they feel from the effects of the drug, or is there like
it works
quicker? Is this?
Yes. If you take a drug by mouth, it's a slow process. You have to ingest it, digest it, absorb it, and then slowly it accumulates in the bloodstream and it does its thing. Whereas if you suppose you smoke it, the area of lung that's available is, I've once read, it would cover about 2 tennis courts.
What?
Surface area. Lungs spread out as a flat sheet. There's a surface about equal to the size of 2 tennis courts. Well, the drug goes into the lungs and is exposed to this huge area and is absorbed very rapidly, and there's a very rapid peak. The same with injecting it. People who use drugs like that get a tremendous rush, and that is a very addictive experience. So drugs that are injected or inhaled are much more potent in terms of development of addiction.
Mm-hmm.
Wow.
So, for example, a typical one is cocaine. people say that they have snorted cocaine for years and years and nothing happened. They never lost control. But once they started to smoke it as crack, it took over their lives completely, and there was no turning back.
But wasn't that kind of a cost factor too, where it became less expensive, or was it about getting the quicker rush?
No, I think it's about getting the quicker rush, because in terms of cost, crack is ultimately devastating to your bank account.
Sure, any of it is.
Well, some people can manage cocaine use on weekends, blah, 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 but crack becomes overwhelming.
Because you need it.
Yes, and the effect is so huge that it's very difficult to change.
Wow. And are people able to explain the differences in their rush or their high from cocaine to heroin to opiates?
Yes.
It's all different.
And patients tell me they don't like the stimulants, for example. They like opioids, which make them calm.
Mm-hmm.
And the reverse is also true. Some people like the excitement of cocaine, and others do.
A rush.
Yes.
Yeah.
But the one thing I want to say to listeners, I think this is an important thing, where opioids is concerned. 50 years ago, it was a hopeless case. Physicians would tell parents, forget your child. There's nothing you can do, nothing can be done, give him up. Well, today, that's completely different. We have treatment which really turns things around 100%. I know, Jennifer, you used to work with antidepressants, and they're fine. But antidepressants, take 4 or 5 weeks to really have a
yeah, that's exactly
benefit.
right.
These newer drugs, overnight, patients come back next day and say, this is a miracle.
Does it seize their urge or their need for it?
It takes away their craving.
Wow.
They have no urge for it. They have no withdrawal symptoms. And what they say is they can function normally. They're no longer obsessed with getting drugs. So
does that become addictive?
No. What it becomes, well, there's a technical term here that's important. People who use, let's say, heroin, become dependent. They can't do without it. So people who are on these medications are also dependent. They can't do without it. But the difference is that with the medication, they can function. With a drug, they cannot.
That was my next question.
Addiction has to do with inability to function.
Well, you hear the term a functioning alcoholic or a functioning opiate addicted person. Is there really such a thing?
I don't think that people out of treatment who are seriously addicted can function. I say that.
They can't hold down jobs. I mean,
right,
and what is the definition of a functioning person? To me, it's somebody that can get up and go to work or go to school and be functional. Take a test, whatever. And some people think just getting up out of bed and walking down the street is functioning. So, I mean, I think there needs to be some definition of really what's a functioning person. And maybe that's the excuse that some people give themselves. Well, I'm functioning. I can get up.
Right. I had one patient last week who, after they began on the medication, they said, look, it's wonderful to wake up in the morning and not be in a panic over where I'm going to get my next fix.
Oh, wow.
I can think about other things. And this person said, I can play with my kids.
Right.
Which in the past, before they could not. Their only focus was on getting and using drugs. This has gone completely with these new medications and new treatments.
Well, so the medication that probably has to be prescribed by a physician that they can take that helps the cravings, if they don't take it, do the cravings come back?
Good question. So the patients oftentimes ask, will I ever get off of this medication? And personally, I used to think to myself, well, I'll try and get everyone off in 2 years. That was my standard.
2 years.
Yes.
Because they've recovered.
Yes. And I found out it doesn't work.
Because they can slip back so
I
quickly.
don't put a timeline on them. I leave it up to them. But once they feel they've got their act together, their life has
It's
changed.
really changed.
They've got away from the people that
Yeah, because it's about
sell
that
them.
as much as it is
absolutely
anything.
is a lifestyle. And once they've got their act together, if they want to get off, I'll work with them to taper them off. And they can get off. Lots and lots of
They're
people
probably
do.
scared, and probably you as a physician, you're probably a little
They're
timid
terrified
about.
of
Yeah,
relapse.
I bet. I would think as a physician, you'd be terrified of that too. And
Yes.
I mean, you want to see them succeed in their rehab, and
But it's
that's
got to be about changing the whole
mindset.
mindset and life set. And I'm sure that that's what, when we
One
talk
of
to
the
the chief,
first-
that'll be a lot of.
One of the
talk to him
first
about.
things they say is they get rid of their cell phone, their
Oh
number.
wow!
So
So
they cannot be contacted
Right.
about selling or buying or
Right.
whatever.
because the drug dealer pursues them
Sure.
looking for a sale.
He's needing the money.
Yes, and
Wow.
so getting rid of your phone number is a good first step.
Wow. I'm kind of overwhelmed by this information.
It is a lot.
It's scary
Yeah.
to me, and it just. I have to admit, I'm scared to pieces of trying any of it.
Right, right.
It never occurred to me growing
To try drugs.
Yeah, no. Number one, I cannot imagine injecting something like heroin from a needle standpoint.
Right.
That totally wigs me out completely. I can't even watch it on television.
Right.
And you see these movies where they're snorting the cocaine like that. What was the crazy movie about the Wall Street guy?
Wolf of Wall Street.
And yeah, that's all they did. They were snorting it in a variety of ways. And the whole I couldn't watch it. And I thought, oh, good grief. I know it goes on daily, and I don't live in a cocoon here, but I know it's readily available. And I think that's another, unfortunately, we'll run out of time, but if you could address quickly about the availability of it in our community and the problem that it is.
Right. The availability of opioids is primarily medicinal pain pills, which are prescribed by physicians to treat pain.
But if somebody's wanting to buy it from somebody illegally, they
It's
could
very
get it.
available. It's very easy to get pain pills.
And is that true with heroin?
We just don't see that much, though patients tell me it is available also. And certainly it's made a comeback in this country at a very high purity and also mixed with fentanyl, which is another opioid, and it causes deaths. So that's a very potent mixture which has laid a lot of people low. However, pain pills remain the number one opioid use, and they're very available. And one of the big efforts has been to get physicians to change their prescribing habits, to reserve opioids for people with severe cancer pain, terminal patients, and not to use it, for example, if you're having your teeth extracted.
Oh, yeah.
They should
Yeah.
not prescribe opioids, yet it's frequently done.
Oh, I'm sure.
And I've heard it said that teenagers who have their wisdom teeth removed
Yep.
are marked. Other kids in the class know
When
that
they
they
have
have a
it.
prescription.
Oh, wow.
Yeah, so they're marked individuals. Getting medicine to change that practice is really important, and a huge amount of effort has gone into making that happen.
So we need to kind of deal with a little bit more pain, sounds like.
Oh, yeah.
When we're having
And
dental
we
work or whatever.
No, you're right.
Take some Tylenol.
I mean,
And to use other techniques. So people have come to realize that opioids on a chronic basis is not a good treatment, for example, for back pain. And so what do they do? Physical therapy, exercise, other non-opioid medications, things like that that come.
Well, all
to
you're
be much
doing is
more
masking your pain anyway. You're not getting better when you're
it's
using
just
those
helping
drugs
you to
anyway.
heal.
Yeah.
Without the pain. Or
Resting,
going
I
through it,
guess.
Resting it, yeah. And chilling you out, so to speak.
Right.
It sounds like what a lot of people are relying on it for. Well, we're about out of time, and I just didn't know if you wanted to have any closing remarks about
I
the
guess
problem.
just one more thing. You may have read in the newspaper last week that all the emergency squads are now going to be carrying naltrexone
I was talking to my sister
for
about that
drug
this week.
overdoses as a way of resuscitating people.
What do you think of that?
Wonderful.
Really?
It'll save lives, And we at Port are discussing making this drug available to all addicts and their families. So when they're in a situation where somebody, one of their buddies, has overdosed, they can give him the injection.
Gotcha.
It'll save a life.
Wow. That's kind of. Have you ever seen the movie Pulp Fiction?
No.
It wasn't that
I would have
John Travolta
terrible.
movie, right?
It was. It was.
Yeah, and the girl was ODing. I think it was on heroin or I don't know the drug. I think it was cocaine, and they did the pen thing and brought her back to life. Whatever. It's amazing how quickly it takes effect.
Yes.
And
yes.
that's,
I think there was something on either 2020 or 60 Minutes pretty recently about a mother kind of battling to make that drug available because she knew she was going to lose one of her sons. They were
And if
actually
she would've-
both of her sons were heroin addicts.
Right.
Um,
So hopefully at Port, we're going to make it available to any family member who wants it because they have somebody in the family who's using opioids.
wow. Well, I know it's a bigger topic and a bigger issue than this show allows the time for, but I appreciate you coming in, and I just think it's important to address it and to talk about it. And like I said, Chief Aiden's coming on, not this next week, but the next week to talk about it from a crime perspective and different ways they're trying to reduce the crime about it. And I know it's a tall order and it's a huge problem to overcome, but we got to start somewhere, and the more we know about it and the more we try to do something about it, hopefully a better outcome with it. So
it's got to be tackled.
it does, it absolutely does. I mean, you hate to see anybody
And it will
struggle
change
with
all facets of, I
Yeah.
mean, healthcare and crime, and
that's exactly right.
impacts everyone.
That's exactly right. So hopefully we can at least deter it. And wanted to get in the topic about legalizing marijuana, but we don't have a lot of time. I know. That's
Ooh,
another
wow.
day, right?
That is.
Yeah, I know.
Last word, just remember.
That's a hot button.
Treatment is available. That's the important thing. Treatment is available.
Good point. Yeah. Well, we've got to wrap it up. Of course, it's time for What's for Dinner. Again, I thank you, Dr. Ames, for coming on the show and talking and giving us a great information about this huge problem we face in our society. So thank you very much. And actually, do you want to give the number for Port?
752-0483.
So if somebody needs some help, please reach out and get it.
Yep.
They're-
752-0483.
And so What's for Dinner is brought to you by Farmville Furniture. Dr. Ames, what's for dinner tonight? Do you know?
I know because I'm cooking.
Oh, good. What are you having?
It's nothing more than a bowl of soup.
There you go. Nothing wrong with
Well,
that.
I like a bowl of cereal,
I
so
know, exactly. Joey, what's for dinner?
Simple.
it might be. We're gonna probably grab something.
Spaghetti at my house. So, guys, get ready. Thank us again to Dr. Ames. Thanks for joining the Greenville Grapevine. See you tomorrow night, 5 o'clock, this time on Star 94.3.